People can just come and go as they please. So morning everyone, it's 9:30. Welcome to this Net Zero Green Hospitals Sharing and Learning webinar. I'm Pete Waddingham. I'm the Net Zero lead for the Academic Health Science Network. And yeah, I just wanted to do a bit of an introduction, tell you about the day, what's going to take place, a few tips and tricks, and then we're going to get straight into all of the different sessions throughout the day, so it'll be fast and furious. But before I did that, I wanted to, as I say, welcome everyone that's live today and watching online. We are recording this session. I know people are very busy, and I've had a few people say, look, I can't make the morning, I can make the afternoon. It's absolutely fine. So thank you for giving you your time. I always start these sessions, those that know me and have been to one of the AHSN's sharing and learning sessions, with an introduction about how I'm looking forward to the event. I mean, they take a lot of planning. It has taken a lot of planning this session, and obviously I'm looking forward to it. But I wanted to start a bit differently with some apologies, 3 or 4 actually, and those apologies are. Not everything today. We've got loads of innovators speaking. We've got over 50 innovators. We've got an international perspective. We've got panel members, but it's not everything that the AHSN are aware of or are involved in. There was about 25 innovators that I also had on my list for today's session that couldn't make it just because of the time, the date, whatever it might have been. And we're not going to be covering all of the topics that are relevant to net zero. So, for example, carbon accounting. Those that know me know that carbon accounting is really important to me. Lots of innovators working in that space. So this isn't going to be everything to do with net zero today, but hopefully it'll give you a really good flavour. I'm also not going to go into full detail about what the AHSNs do, but do connect. I've got some brilliant colleagues coming along today to help me out. They're going to be in some of the sessions. They'll be on hand in the chat. I will briefly touch on what the AHSNs do, but if you're not aware of what an AHSN is, either you're working in the health system or you're an innovator, check out our links. Do connect with your local AHSN. And the last thing I wanted to apologise to is each of our innovators, I've only given them 10 minutes. There is a bit of flex in there. I think we've got like a 15-minute slot. So within that 10 minutes, I've asked them to give an overview of what they do, some of the impact that they might have had today in terms of carbon impact. Some of them are going to talk about a case study. And then finally, I've asked them to finish on what is the ask? What do we want? What do they want from the system? Now, obviously, this isn't...
Well, a very, very heavy
Sorry, just if you could just put your mics on mute. So yeah, finally, what is the ask? And some of them just need a little bit of time. They just want to sort of talk to you and understand how their innovation could land. Some of them want to talk about financial models or alternative financial models, etc., etc. And you'll see that today. So apologies to the innovators. I know 10 minutes is tight, but I know you'll do a good job. And I've been working with many of you just to try and to articulate that. So obviously I wanted to say thank you for everyone that's given up their time as an innovator, as a panel member. And those of you who have registered today, we had 436 in the end, which is absolutely fantastic. And as I said, I know we'll get many more watching online afterwards. Hopefully there'll be no technical issues. It's always the case that something will happen. My computer already this morning went and started making strange noises. So just be sympathetic to each of the sessions. It's inevitable we'll have some form of technical problem, but we're all well versed in Teams and we're all well versed in just seeing this through. So hopefully nothing too major. So just some tips and help throughout the day to make sure that we all get the best out of it. As I said, there's going to be a lot going on today. Don't worry if you can't make all the sessions, it will be recorded. As I said, please turn your cameras off and your mics if you're not speaking and when the speakers are presenting, and that actually saves carbon too, which is brilliant. If you see something that you like that's not your remit, please tell someone, tell your colleagues, tell someone, share that knowledge. Obviously, these sessions are here to allow people to network. So network in the chat. If you can, try and post your questions in the Q&A. So along the top of Teams, you'll see a chat function, a Q&A function. Try, if you can, please, to put the questions in the Q&A. It'll just help us facilitate it a bit easier. But as I said, network in the chat. Those that know me as well, when I attend sessions, I always do. I think it's important to collaborate and connect. Not everything you see today will be of interest. That is absolutely okay. Innovation can take time. We have got some really early innovators still developing, some of them that have got really good traction and everything in between. But as I said, not everything will kind of get the cogs ticking today, but it does take time. But I'd like you to help the innovators and all of the people in the panel that are speaking today, but help them with their ask. You know, as I said, some of this is just kind of quite light touch. They just want a little bit of time, help to understand how to develop their innovation and obviously benefit the net zero agenda. I also just wanted to thank you and apologise. One of the things I asked people to do when you register for this event was to say, if it was a face-to-face event, how far would you have travelled? And I've just put some statistics on here. So 48% of you would have used the train, which is brilliant. I would have done the same if it had been a face-to-face event. Some of you would have had to use an aeroplane. We've got some international speakers today. Obviously, there's the use of car. Not many people use the bus. I am a fan of park and ride facilities, but there we go. But actually, what really stood out for me is when we look at a round trip, it would have been about 100,000 miles that people have contributed. I'd say we had 436 people from all over the globe registered today, and as some of those of our speakers. So I've worked out some crude carbon impact. You know, we would have spent about 38,000 kilograms on CO2 of travel. If we'd have had a venue, about 830, you know, maybe a bit of hotel stay for our international guests. Food, I didn't end up calculating, but we actually have got an innovator whose bread and butter innovation is around food and carbon impact, so I'll leave that to them. Obviously, we do have a carbon impact when we're doing sessions like this remotely, but you can see it would have been a big carbon footprint and equivalent to around heating or providing the electricity of nearly 8 homes for a full year. So I say that was just a little bit of fun, but I do think it's really useful to consider what the carbon impact would have been if we had have done this session face to face. So I said I'm not going to talk too much about the AHSN networks, but for those that don't know and you are connected to them, please do. There are 15 up and down the country. I work for the AHSN network at a national level. I previously worked for the Yorkshire and Humber AHSN for 5 years. So we try and spread healthcare innovation at pace and scale. Not an easy task. And I'm sure you know we all appreciate the pressures within the health system, but that's what we're here to do. We've got a brilliant website to find out more, and I'd love you to go on there and connect with your local HSN or even the sort of main HSN website. And I just thought I'd give like kind of 3 things what we do, a very summary version from my perspective. But we obviously work with innovators. We help them articulate their value propositions, navigate the regulatory landscape, lots and lots of other support for innovators. So this is just a very quick snapshot. And as I say, you'll see some of that today, some of the innovators that are going to present. We help broker relationships. And again, a bit like what we're doing today with the NHS, but actually it's about brokering relationships with others sometimes. Collaboration is key. And the network in the AHSN network name was always important to me and still is important to me. And then finally, the thing that we also do is we help navigate the funding landscape. It can be quite complicated. Currently, I mean, I do a bit of tracking of the funding landscape, and there's around £10 million live net zero funding covering various things. A lot of it's around research and development. And we have a funding bulletin that the system and innovators can sign up to, and we try and help match some of that funding up. And I'm just going to give one very quick example. The SBRI call is just come out again. The webinar is on the 22nd of September to launch. So that's a really good small pot of money. I mean, it's up to £100,000, but it'd be ideal for some of the things that we're talking about today. So please, again, we'll put this in the chat, register for that webinar, have a think about some of the innovators that are presenting, and let's try and secure not only this funding, but some of the other funding that's out there. I just want to spend the last couple of minutes giving an overview of the agenda today. I've sent you a couple of emails. I've tried to explain it as best I can, but it's not always easy explaining. So I just thought in an email. So I just thought I'd try and bring it to life. As I said, there's a lot going on. The first session, we're going to have an opening introduction from Healthcare Without Harm, which is fantastic. You know, just to understand, I wanted to have an international perspective in this event, and we've got like three of those today. And the first is Healthcare Without Harm, talking about how they're driving sustainable innovation in healthcare. We've got Health IL, who are going to be talking about the Green Hospital project that they did in Israel, and they're bringing a couple of innovators along with them. At the same time, I said there's going to be a lot running in parallel. So at 10 o'clock, we've got 2 themes running. Models of care, and there's 2 groups within models of care. Travel and transport, there's 2 groups. You can click on any of those links. You've seen in the agenda that you've got and been emailed all the different innovators, so you can jump in and out of sessions depending on what you see fit, or you can stay in a session, see the full session right through. It's entirely up to you. Dinner time, we've got roundtable discussions. Again, you've seen who the panels are. We're going to probably do similar discussions, really. So it's not that important which one you join, but you'll see who's going to be part of the panel, and you might pick on based on who's in a certain panel. But we've got Dominic Alwood, who's Chief Medical Officer, chairing and facilitating one session. I'm doing the other. And then in the afternoon, same sort of format. Estates and facilities is the theme. Looking at everything from waste, energy, water, ventilation, then consumables, looking at a range of different consumables as well, from PPE to medical equipment and gases, food, IT, signage. And again, there's a couple of groups that you can join. And as I said, I've got some AHSN colleagues on hand to help you out. So hopefully that is all fairly self-explanatory. And then right at the end of the day, we're going to just wrap it up with a little bit of feedback and reflection about the day and what we've heard. So thank you for your time. Thank you for coming along. And without further ado, I'm going to hand over to Arianna and Ali to talk about sustainable innovation in healthcare.
Hello, Pete. Can you hear me well?
Yes, we can, Arianna.
Okay, thank you very much. I'll try to share my screen. I'm not sure I have the permission to do that. Oh, here.
You had me panicked then, Arianna. I think. Have you got it?
1 second, I have it open. Okay, should work now.
Lovely. Yeah, it's coming through. Perfect. Off you go.
Okay, great. I cannot see you, but give me a shout as if something is not going well. So good morning, everyone. Thank you for inviting me to this very exciting event. Our presentation on Healthcare Without Harm Europe today is about driving sustainable innovation in healthcare. And a few words about us. We are a network of thousands of hospitals, healthcare leaders, and healthcare professionals with members across Europe, and we also have partners across the globe. And together we want to prove that it's possible to deliver a high quality of care in a way that it's sustainable financially and environmentally. We have different networks where our members, like healthcare providers, but also doctors, nurses, and pharmacists can connect, share best practices, and learn, share their challenges and learn from each other. Our Global Green Healthy Hospitals in Europe has over 180 members in 25 countries, and you can see it in the map. And this is our reach, again, in Europe. Briefly about our programs, we work primarily on 3 program areas. One is climate smart healthcare, which is looking at reducing the emission of the sector. Circular healthcare, that is looking at reducing waste and toxics, and safer pharmaceuticals is looking at tackling AMR and preventing the pollution of pharmaceuticals in the environment. So as I said, climate smart healthcare, the strategic goal is that the European healthcare sector is transformed into net zero carbon and climate resilient sector that protects public health from climate change and accelerates the transition to a low carbon economy. And then for the circular healthcare team, we look at the European health system, drive markets toward toxic-free products that conserve finite resources, minimize waste, and contribute to an ethical supply chain and circular economy. And the safer pharmaceutical, again, is about pollution, and it's contributed to the development of antimicrobial resistance to minimize it. So why we are here? I think by now most of you know about environmental impact of the healthcare sector. Just a couple of data to make sure we are on the same page. Globally, the footprint of the sector is 5.2 of the total carbon emissions, which means that if the healthcare sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. We know that the supply chain drives over 75% of emissions within Europe, for instance. And we know that the sector is not only about emissions. The sector consumes a lot of energy, water, building material, pharmaceuticals, medical devices, food, and so on. And so this results in environmental pollution and waste generation. And so we also know on the positive side that it is a huge sector with a very powerful influence. It has a big economic influence. In Europe, its purchasing power accounts for approximately half of public spending. And in Europe, it's 14% of annual EU GDP. And procurement of innovation is a strategic tool to achieve the sector's sustainability objectives. So we can leverage the procurement of the sector to drive low carbon, toxic-free, and zero waste solutions. What is the role of Healthcare Without Harm Europe in all of this? So this is a picture of us, for instance, running waste audits in hospitals. You can see a lot of single-use cups, paper cups, not a great solution to replace the plastic one. So we push for innovative solutions that meet the sustainability needs of the healthcare sector. So we research and highlight the sector's sustainability concerns, its unmet needs, for sustainable solution, and aggregate the demand to give a clear signal to the suppliers. So we need to make sure that when suppliers come up with innovation and new solutions, they are addressing the unmet needs of the sector for more sustainable solutions. So we need to create this dialogue, and I guess this event is great to do this. And so in light of the audience that we have in the event, I just wanted to give a few examples of the unmet needs that we have identified in the sector. We produced a European healthcare phase-out list for chemical of concerns. So for instance, in that list, you will see that we are pushing for PVC-free alternatives. We also have sustainable procurement criteria for exam gloves. And there we have a series of market dialogue questions about how we can improve the materials that are used, how we can improve the packaging so gloves are not waste when are extracted from the boxes. How can we improve the transparency of the supply chain? And how can we minimize waste? What are the end-of-life solutions that we can apply in the healthcare sector to minimize the waste of gloves? And we also have sustainable procurement criteria for medical textiles, again, looking at the fiber type, product functionality, looking at things like usability, repairability, product durability, and so on. And we also supported one of our members together with another project, EcoKeep Plus, in developing a joint statement of demand for zero waste operating theaters that I encourage you to have a look at. And we indeed want to identify solutions that are at the bottom part of the waste hierarchy. So the waste hierarchy is sort of our compass when it comes to circular economy. And the important things when you look at solution is focusing on the upper part of the waste hierarchy, when we prevent the product to become waste in the first place. And so, for instance, phasing out single-use items. And also we launched very recently in 2022, the Procure for Health project and community, of which my colleague Ali is going to talk about. And this project is really looking at how can we foster innovation in the healthcare sector through procurement and come up with the unmet needs that we need to give to the market for more sustainable innovation. Ali, are you with us? I will hand over to you.
Yes. Hello, good morning, everyone, and thank you for this session. So my name is Ali Fakih, and I work in Healthcare Without Harm Europe with Arianna. And my work is in a project called Procure for Health. So before I jump into what do we do in our work as Healthcare Without Harm Europe within Procure for Health, I would like just to have a brief to introduce what is the project Procure for Health. Next slide, please. So what the Procure for Health project is it's a community, it's a growing community of health and social care organizations and procurers that are interested in the innovation procurement. It started first with 33 consortium members. We are one of the founding members of the Procure for Health community, but currently we are more than 100 members. I'll share my slides. I think it's better, Arianna, if you stopped yours.
Yeah.
Yeah.
Stop sharing.
Can you confirm, Arianna, if you can see my slides in full screen mode?
Yeah.
All right, perfect.
Yeah.
All right, so as I was saying that we are we are founding members of 33 members, but currently we have going to become more than 100 members of interested or procurers and organizations in the health and social care interested precisely in procurement of innovation. So the aim of this community is to come together in collaboration and to promote innovation procurement through different methods, including knowledge sharing, including capacity building, including networking and matchmaking, and the launch of joint actions, and also influencing policy. And one of the most important one is the identification of common unmet needs. In this session, I would like to focus on this part, which is the identification of common needs. And what do we mean by this precisely? So at Healthcare Without Harm Europe, we are leading a working group titled Sustainability in Procurement of Innovation. It is one of the many working groups, and the aim of this working group is to promote sustainable innovation in procurement through collaboration of different members within the working group. Now, how do we do this? Before I go into how we do this, I want to just give a small definition of how we define sustainable innovation within this context. So sustainable innovation is to make the intentional changes, and highlighting intentional changes to health and social care's products or services or processes in favor to generate long-term social and environmental benefits, but also creating and yielding the economic benefits of our choices. So to have this, we have the first, what I mentioned before is the needs identification. So the working group aims to identify sustainability unmet needs and map these needs along the Europe and see where many European procurers have the same unmet needs in order for future joint collaboration on procurement or cross-border procurement. These needs are, to make it more in the simpler terms, we call them as problems. So these needs are problems that possess challenges on the current sustainability processes of our actions within the healthcare sector. So the aim is to have this demand-driven identified need, and by demand-driven is challenging the conventional way of going to the market and finding a solution and buying the easy, cheap price solution, but rather defining exactly what our problem is and then looking to the market or driving the market toward a sustainable solution after having a joint demand of unmet needs. By this, it's the first step towards sustainability, as this way, whatever we get into our organization, we make sure that we have studied on how its life cycle and where it will be after we finish from it. So when we speak about needs, we have different types of needs we speak of, and we try our best to address all these needs. We have needs that are, for example, a product, and these are the products that are directly linked to the end user. For example, when we speak of textile, clothes, gloves, etc., usually targeted to the patient or the practitioners. The second one is the need for product information, and this is the information related to the product itself, but in a sustainable terms, we mean by its life cycle, its manufacturing details, its emission, so on and so forth. The third one is the need for information and change of our expertise and exchange and sharing information and best practices within our organization. The fourth is the need for sustainability infrastructure. This consists of the guidelines and procurement process, the funds and staff, in case there's a need in that. And the fifth, the last but not least one, is the need for the market information. And this means the European market. They need to know more about the laws, regulations, national and the national and international level. So these are the different types of needs that we try to address. I would like to finish my presentation by giving an example of an identified unmet need within the Procure for Health Sustainability Working Group that we're leading on. One of the needs is after COVID, the use of single-use face mask has been increasingly been used, and has been disposed, and it has a certain risk because of the it contributes to environmental pollution because of the non-biodegradable materials it's made of, but it also because of the improper disposal, and also because it is really intensive manufacturing process, generates a lot of more hazardous waste to the environment. So this is one of the problems we have identified, and we say this is the problem. So when we come to look for a solution, we have to make sure that we are open-minded to various solutions that are existing in the market, either as a commercial ready to adopt solution, but also maybe still in the research and development phase. So we have a wish situation. The wish situation is that we want to have a healthcare sector where we have an alternative to the single-use face mask, and that also provides the same level and protection as the disposable mask, but also reducing its environmental footprint. So by that, we make sure that our approach towards this need is thinking about it through a sustainable way, but also not replacing directly with what we think or what is available, but rather to have really the open market consultation and analysis to have a full view of the different solutions, sustainable solutions to that need. Now, if you're thinking how you can what are the next steps, or how you can be part of this, or how you could also collaborate with us in order to in the Procure for Health, you could either contact me directly. I will share my contact details in the second slide. You could visit the procureforhealth.eu to know more about the project. If you're a procurer, but even if you're a supplier or a supporting organization like universities, research centers, etc., you could just go directly to the community.procureforhealth.eu, join the community, but also join the working group on sustainability. I think this is it from my end. These are my contact details. Please feel free to contact me in case you have any further questions, you have any wishful collaboration. And thank you very much. I wish you a fruitful event.
Thank you, Ali, and thank you, Arianna. If it's okay, I'm just going to reflect for a minute or two on your presentation, if that's okay. Fantastic. Thank you for doing that. As you know, I wanted to try and weave a bit of an international perspective. I'm hoping that we can join forces a lot more following this event and really start sharing some of the learning. And I'm absolutely certain that there'll be innovators on this call listening to your presentation, and system leaders from the NHS that will absolutely want to connect and collaborate with you. And that is fantastic, because I think there's a real strength in numbers when we do all connect and collaborate. So thank you, Ali, for sharing your details. I'll definitely be checking out some further work and making contact with you and Arianna after this call as well. There are some questions in the chat, but just because of time, what I'm proposing that we do is maybe just sort of eyeball them and maybe respond in the chat to some of these. I can see a question or two about, again, more of a connection with an institution. There's a really good question about how we get clinicians, particularly nurses and midwives, being mobilised to lead the decarbonisation of clinical and care pathways. So just 1 minute, and not to put you on the spot, Arianna, but have you had much traction with really getting clinical transformation on net zero in some of the work that you've done in Healthcare Without Harm? So I don't know if that question makes sense, but have you managed to work with frontline staff to really start changing some of the clinical pathways? Because again, one of the themes that's just about to start now is models of care. So I'd be keen just for a minute just to reflect on that question, please.
Yes, I think it is critical, because at the end, especially when it comes to waste, maybe when it comes to carbon footprint, that's a lot of measurement, calculation, looking at procurement data and so on, or energy data. That's more with the technician or procurement staff and so on. When it comes to waste, the clinicians are the one on the front line. They are the one that are experiencing and seeing the issue of waste, and so they are actually the one that are really driving these demand and need for better solution, because they experience it and they can see that there is a need to change this approach. And so actually I think a lot of the best practices we have is actually nurses or doctors identifying solutions in their practice and say, is this really needed? We have things about custom packs a lot of products that are packed in the same thing, and then they have to open the pack. They use maybe one thing, the rest has to be thrown away because it's not been used, but it's not sterile anymore, and that's a lot of waste of unused products, which is, I mean, if you think. And so it's actually the clinicians and the clinical staff that is when it comes to waste that are driving the demand for better solutions, and they can also, you know, highlight where are the unnecessary.
Absolutely, it's fundamental, and as I said, it kind of segues to some of the other themes that are just about to start on models of care. We really need clinicians to look at how can we deliver the care that we're currently delivering in different ways, and look at sort of the consumables, the waste, etc. And obviously, I want to keep us to time, so thank you again, Arianna and Ali, for your presentation. Again, it'll be the start, I'm sure, of many contacts and collaborations. Before we go into the next session, just a quick reminder of what's going to happen. So at 10 o'clock, we've got 2 themes going on with actually 4 different groups. So the first theme is models of care with 2 groups. The second theme is travel and transport, again with 2 groups. Go and join the themes that are of interest to you the most, or some of the innovators that are interested. If you want to stay, and I'm hoping you do, in this room and listen to Health IL talk about the work that they did in Israel on a green hospital project, please just stay in this room. But as I said, it's not a problem. You can go where you want to today, find the things that you need to find out. So thank you again for your time. And I have got an introductory slide up just to bring it to life, but I can see you on screen. So if it's okay, I might just hand it straight over to you.
Yeah, of course. Sure. Just let me know when to begin.
Yeah, please do. Please share your slide, and we'll bring your presentation to life.
Fantastic. Okay. Okay. Everyone see what I see? Yes, no?
Yeah, we see it.
Okay,
Yes,
great.
yes, perfect.
Okay, wonderful. So I'm actually really happy to share this with you. My name is Yoav from Health AL. With me is also Daniela from Health AL. And we want to share with you a little bit about what we do, but then deep dive into a project that we did here that is highly relevant for this session. And thank you, Pete, for organizing this entire thing and inviting us. So we're going to go real quickly just about us, introduce the specific project that we did, and then we have 2 special guests, Yoav from Nostromo and Ofer from Solight, who are actually 2 startups here in Israel who are very active in this interaction between startups and technology and you know, carbon footprints and whatever. And then we want to leave it open for the entire audience to chat with us about what we do. So what is Health AL? Health AL is a not an international, it's the local ecosystem for health tech in Israel. It's a non-profit, it's independent, except that people on our board are governmental. The Ministry of Health, the Ministry of Economy, and the Innovation Authority. We do 3 main things. We do a lot of innovation management work, the underpinning infrastructure and processes by organizations can start to interact with technologies and startups. And we built quite a lot of the tools and methodologies that are used here in Israel. More and more we're working in Europe to also help those organizations as well. And when you build up these infrastructures, it creates a more effective collaboration with startups or with technologies. And how do you work with them, and what's the correct pathway, and what's, you know, necessary to integrate them or not. And because we're governmental, we obviously work with our friends on a lot of policy and infrastructure work. We're involved more and more with international projects, with the NHS, with various countries in Europe, etc. Our entire ethos is that innovation in healthcare is extremely complex, right? It's one thing all of us can get online to LinkedIn and meet any startup we want. Our entire approach is to look at it from the perspective of the challenges of it, meaning unpack and understand and really love the complexity of healthcare. And only then, when you really understand that, can you find the most appropriate solution. So we deal with a lot of stuff. We have a lot of startups. Great, wonderful. We do quite a lot of projects. These 960 startups are just health tech, meaning we don't do chemistry, we don't do molecules, but there's quite a lot here in Israel. So we do a lot of activities over the course of it. I'm going to speed up on this. I'm not going to go over through one, but they basically fall into 3 different things over the course of the year. A lot of education, supporting innovation professionals, supporting founders and startups with best practices, supporting tech companies. The whole goal is to transform systems. So we do a lot of regulation, policy work, and ultimately to build and scale the integration of technology. And the important part here is that frequently startups say, oh, I want to scale this, I want to scale that, but we also see it from the perspective of the healthcare systems and the organizations themselves. How do they scale and how do they integrate beyond just doing some initial pilot? We're happy to talk about that later. So what we found over the last number of years that we've been working, and this segues into the project, is that government support is critical for the success, right? Here in Israel, we have a couple of unique infrastructures that help. And building the infrastructure for innovation management is absolutely critical. We really want to help organizations be independent in how they do this. You know, and what we're going to see right now is that there's quite a lot of potential for new solutions in healthcare. But we really try to push through this holistic approach of understanding all of the stakeholders and their complexity. So we do a number of projects, and I want to zoom in on the one on the left. This is a project we did quite a while ago with a hospital in the south of Israel. It's called Solight. It's actually way down in Beersheba, which is where kind of the desert starts. Solight is a major hospital because it serves the entire southern 60% of the country, which is very demographically diverse, has quite a lot of consideration when it comes to remote care. You know, and access to care because of the massive size. So the goal of this project, and now this becomes interesting, was to reduce climate impact of this healthcare organization through technology, through startups. How do you do it? The method by which we did it was what we called an open call, effectively a challenge competition, where we match these startups and these innovations to the actual climate needs of a hospital. The big important part of this is in the preparation, right? The preparation is to first define what is that challenge, right? And we start very high. What's the focus area that you want to address? You meaning the hospital or any other organization. It could be HVAC, it can be water, lighting, whatever. Within that, we drill down. We drill down to define a specific actionable challenge or need that we want to address. For example, with water, optimize the heating process while increasing system efficiency. That is something clear and defined, and this is a very critical step. And the reason I bring this is because, you know, we are all probably involved in hundreds of these types of meetings, and it's really important to take the good intentions at the high level and distill it down into very practical, actionable things. So that step from a focus area to a defined challenge is really critical. The next step for that is the resources. If I'm going to address optimizing heating processes while increasing system efficiency, what is that? What current system is being used? What metrics are being used to assess efficiency? What metrics are going to be relevant in the future? Is there a data component? Yes, no. All of this stuff is really critical to understand because I need to know how the organization operates because we need to know how the startup can interact. And finally, we want to know what a successful actual assessment of this would be. What would be the KPIs for potential collaboration? Like if I'm going to find a startup that optimizes heating processes while increasing system efficiencies, how do I measure that success? And that can be whatever is relevant, right? It can be kilowatt per hour. It can be kilowatt per hour pounds, whatever it is, but it's going to be tied into that specific challenge, which is tied into the focus area. So next, we launched this. We've defined, we worked with the hospital. We outreach to invite startups, innovators, and they do not necessarily have to come from the world of health. They have to come from the world of this challenge. And we do an initial screening, right? We're matching what they do to the actual needs of this challenge. And we select these finalists based on whatever criteria. Great. The next part about the implementation is critical, because it's one thing to just meet 3, 4, 5 startups, and it's another thing to start working with them. And the implementation is the next step where we actually want to make this tangible. So we have to define what a collaboration would look like with an external startup for this challenge, right? Is it a pilot? Is it an observational study? Is it some code development? Is it potential straight procurement and commercialization? Whatever it is, that needs to be a defined proposal where we approach these finalists and do a deep dive assessment. Eventually, hopefully, you find one that fits, and that's effectively the winner. Great. When we did this in Israel, we had, with Soroka, we had a defined challenge. We had 40 submissions from various companies, of which 8 became this next round for interviewing, of which 3 got to the level of the pilot proposal. In between, we defined with the hospital what the collaboration pathway would be. In this specific case, it was a pilot, of which there was 1 winner. Nostromo, who you'll meet shortly, was the winner. You can see here, we'll now pilot the integration. Of course, piloting requires time and effort. Wonderful, but at least the progress is being made. I do want to put something in the back of our minds before we continue. There's always the question of who's going to pay for this, right? And there's 4 main pathways that we should all explore. One is it can be self-funded. I, as the hospital, can say, I'm going to cover all the expenses of this initial pilot. Of course, this does 2 things. This puts this obviously I have to, make a strategic decision to release these funds. But it also means that there's now an emphasis on economic ROI, because there's the potential where if over the pilot, the startup can prove to me savings financially, there's motivation to continue. The other way is for the startup to fund it, but the startup covers the expense. What this means is that I, as the organization, still need to give that startup some value add. Otherwise, why would they want to work with me? It can be a pilot site, it can be access to whatever data, it can be whatever I want to define it. If I'm not giving them money, I have to give them something. Otherwise, why work with me? In this case, the startup would cover the expenses and they have to make their own considerations. Another option is grant funding. There's a number of excellent organizations all over Europe and the United States who see the relevance and importance of what we're doing and what the sessions it is about. It does require research and time to find them, but they're there. And I highly recommend looking and applying, saying, we're going to do this open call, we're going to address the specific challenge, we need support. And of course, the system funded, right? This would be where the NHS covers it. Again, this is not, this sounds easy, but obviously that consideration where you need to prove to the system that this is worthwhile, right? That this has justification from the climate perspective, from the financial perspective, with the potential rollout for additional savings, both climate savings, climate protection, and financial. This can also be fit into various procurement pathways for startups that are more established. My closing thoughts. We would love to do something like this again. That's why we're here. We see a lot of potential interesting interest in this, and we would love to do something about this in the future. So the question is, how do you do this, right? And we would love to find some ways to expand on what we did here. That being said, I would love to actually invite Yoav from Nostromo to share with us what he does. He was the winner of our challenge competition that we did about 1.5 years here in Israel. Yoav, can you join us?
Hi all.
So feel free to share your screen and let us know what you do.
Yeah. Hey all, very happy to be here among you. We are broadcasting from the allegedly the last democracy in the Middle East, still hanging on our both feet, and we hope to stay so for in the next millennia. So Yeah, thank you very much for this opening. Health IL brought this opportunity to Nostromo. Nostromo is a company that was established in Israel, but actually our beachhead market is California, USA. And the reason for me saying so is only because of the market, I would say, maturity, the maturity of the energy market in California enable us to incorporate our technology into buildings, which I will go through that in a minute, in a way that will make sense financially. And of course, all of us can be great, have great ideas and very impactful and helpful, but if there is no a financial base for what we are doing, we understand that no one will really, risk money only because it's good for the environment. It's always driven from some kind of financial sense. So I will share a little bit less with themes. Let's I'll find the share screen. Here it is. Yeah, found it. So yeah, so what Nostromo is doing is decarbonizing big commercial cooling systems, which are usually located in big commercial buildings. And this sector of commercial buildings, one of the, I would say, is most important, partners or in this kind of group is our hospitals, which are huge complexes usually being fed by central cooling systems, if not distributed. Nevertheless, hospitals use a lot of cold energy for various reasons, not only for thermal comfort per se, but only for other refrigerations. And in operational rooms, we see much lower designated temperatures in order to hold, bacteria from thriving and so forth. So, of course, if you are from, and I'm sure you are aware that between 20 to 50% of 20 to 40% of the total electricity consumption in hospital is designated towards cooling systems. General speaking, commercial buildings are using about 74% of all electricity. This is an amazing and very, I must say, reasonable number, because who else is using electricity but buildings? And now more and more goes into mobility. But still, from all this electricity going into buildings, about 40% in total will go to thermal comfort. In England, it might be lower, but I have two things to say about that. Most of the countries in the world are situated below latitude 30 north and above 30 south. So the general climate is controlling the peak demands of the grid, and the reason that the general climate is controlling the grid is because of cooling systems, active cooling systems. And anyway, above the 30-ish latitude line, these countries are suffering, more and more heat waves and change in climate, which push them into putting more and more cooling systems. As for hospitals, as far as I know, every hospital in the world is using cooling systems. They are not waiting for the cold weather to do, or they're not waiting for the next heat wave to make these decisions. They are being supported heavily by cooling. So what am I talking about? I mean, what is actually decarbonizing cooling system? So there are two ways to decarbonize activity of a building. The first way is just to use less, and this is about using better in a better efficiency, using your electricity, lowering your on-site burning fuels for heating, and and make it more make your building or your walls more insulated and so forth. So this is one attitude. It is let's use less, and that works amazingly until a certain threshold, which you cannot really improve beyond that if you keep your activity as viable. The other thing, and this is a totally new thing, this arena is called Wanergy, and this is mainly connected to when you are using your energy. So in advanced countries, which has a lot of wind and solar, what's happening actually is that the kWh you consume from the grid doesn't have one carbon footprint. The carbon tag, or the carbon price, if you might say so, of every kWh you take from the grid changes along the way dramatically. In California, which we are active, you can, inside Los Angeles, through daytime, you'll get your kWh at almost 0 or 50, up to 50 grams per kWh carbon cost. After 4 p.m., that number spikes up to 600 grams per kWh, because when the sun is setting down in California, the state is in emergency, energy emergency call because of the loss of 18,000 megawatts of solar, and the peaker plants, which are very inefficient, very contaminating power houses, start kicking in order to support the loss of the solar production from the sun. And there you are, there you can hit the 600 grams per kWh. So generally speaking, now let's say you're a very efficient hospital. Let's say you're very insulated, you have the best machines, you have LED lights, whatever. You do good with your waste, and you even moved all your heating sources to electricity. Still, you have a heavy scope 2 emissions related to your electricity consumption. Now, of course, if you're move to electricity, somebody is burning fuels in order to, at least at some times of the day. So we are acting on the right-hand side of this picture. So in the middle of the picture, you see the distribution system. Today, most of the production, leave alone rooftop solar, most of the production of the electricity is done on the front of the meter side. Most of the storage is done front of the meter side. The electricity is produced and being distributed into the cities, and the cities are consuming the electricity in a fashion of right-on-time merchandise, meaning as long as they need their electricity, they get it. If they don't need it, they don't get it. And we are changing this reality. Nostromo has developed a system, technology, that can store energy in a clean and sustainable and durable way, and I'll show it now in a second. It's being retrofitting. We are retrofitting buildings, only commercial buildings. We're doing only retrofitting of cooling systems, and we enable the entity to take very clean electricity through daytime, or if you are heavy with, let's say, offshore wind production at night. So we will charge our system at night. It's all about this momentarily volatility of the carbon emission related to your kWh, and we will take very cheap electricity on carbon, and usually it will be cheap in money, and we will store systems. We will discharge them at peak hours, avoiding heavily carbon manufactured electricity, and of course usually a very expensive one that goes together. Maybe before I will talk about our technology, because you might be already curious enough. So we developed the ice brick. The ice brick is a very, very sophisticated, although simple in design, ice storage cell. This cell that you see is 4 meter long and 25 centimeters high and 50 centimeters in width, and can hold 10-ton refrigeration hour of cold energy, which are equivalent to just about 10 kWh of electricity. It might be more, it might be less. It's really depend on the cooling system you are avoiding when you're discharging cold energy. Just to make all of us, on the same page, central cooling systems, like in hospitals, use water in order to cool them, chill them, and distribute them through all the parts of the hospital. And then these hot water come hotter, a little bit hotter, into the cooling center, and then chilled again using electricity, of course, and then circulated through the building again. Every room gets its own fan coil, so the cold water, chilled water, which are around 7 centigrade or 45, just about 45 Fahrenheit. So the air meets a fan coil. It's a small heat exchanger and ventilator in your room, and you get cold, chilled air, which actually exchange heat with the water, which are going back to the chillers. We store a huge amount of ice at a certain space in the hospital, and we using to build this ice clean electricity, like I said, and we are discharging this cold energy through our cells when we want to avoid the peak hours and the most contaminated kWh from the grid, and we are discharging through with a liquid which is called an agent through our capsules. It's encapsulated ice system. We're circulating it and discharge the cold energy into the building, and we can put down the systems or the electrical chillers of the hospital for long hours. How long? So in the Hilton Beverly Hills, which we are situated, I'll go straight there. Okay, this is very important. Just to have one word on it, the system that I'm describing for you, like the carbon accounting, meaning who. You're asking yourself, what are you saying? You're saying that the carbon has a different and like moving dot or dynamic carbon price at each and every second. Who knows about it? Who's doing anything about it? How can we install it or manifest, or utilize it? So I'll tell you that, and you'll be aware of it, if not through this lecture, in the next 2 years or so. Everybody will know about it, because this is the only way to actually calculate your scope 2 carbon emissions, meaning it can't keep going on that your electricity from the grid has just one carbon number, and it doesn't matter when you are procuring it or using it. When this number moves from 0 to 600 grams per kWh on a daily basis or hourly or momentary basis. So of course this is not a good way to help everybody to understand what are their carbon liabilities. So this system that you see here in front of your eyes is already in use in United States. I don't know if you know, but New York City is going under local law 97 LL 97, which price every ton of carbon, metric ton of carbon above. It's interesting that almost the only way that you can make American people use the metric system is with the ton of carbons. This is funny because I work in the United States and I'm struggling with the imperial system. So every excess ton of carbon above a certain threshold in New York City, from January 24, they will pay $268. So they will all be using these kinds of systems in order to determine the exact carbon liability, scope 2 liability of carbon of commercial entities. And we are sure if you'll go to emissionfirst.com. So Emission First is the leader nonprofit organization that leading this way of carbon analytics, and Meta, Facebook, Amazon, Akamai, General Motors, Intel, and other huge corporations already joined this way of thinking and way of paving the road to show everybody how they should treat their carbon emissions, scope 2, I mean, the ones that somebody else is burning fuel so you can enjoy your electricity. So the difference between what we're doing and lithium-ion batteries, I hope it's very clear. We're using water, we're freezing and melting water in order to avoid cooling systems. And this is the most sustainable, clean, durable, long-lasting way of treating the needs of buildings to transform into what's called grid interactive. So this is the big picture. The big picture is how to transform as many as we can commercial buildings and become help them becoming grid interactive assets. When you take a building and you're transforming into grid interactive asset, you can get a virtual power plant. And actually we were awarded, not awarded really, like we are under the loan program office of the DOE, the Department of Energy, and we are now securing $300 million to loan in a special purpose vehicle to loan this money to a customer of ours in Southern California. And actually 2 weeks ago, the CPUC, the California Public Utility Commission, which is one of the most electric authorities in California, announced or cleared us to be a provider of capacity to the grid, meaning we are now officially acknowledged as a relief services suppliers to the grid. What that means, think about all these buildings which consume at midday, many megawatts of electricity, and think that in one push of a button, we can make all of these stop using electricity for the cooling systems for 5 straight hours. And now we're, providing a huge relief to the grid. How much that worth in infrastructure investment, in all this instability of the grid? Yes.
Sorry, I have to cut you off. Yeah. Keep going. I'm sorry.
Okay.
So last line you want to say?
Just to show you the system in the Beverly Hilton. This is how the system looks like in real life, and to show you the Soroka hospital system, which is adjusted to the operation room in Soroka, and we are now in the design stage. We can, we bring them different ways to install the system, and they are so it can be incorporated and become part of the landscape in the hospital. But dramatically support the way that the hospital uses its electricity. Thank you.
Yoav, thank you so much. I want to invite, please stay with us because we have Q&A
Sure.
at the end. People may have questions. Ofer, I would love for you to join us, please, and share with us for the next 15 minutes what you're doing.
So, good morning, everyone. A pleasure to be here. Solight is also an Israeli startup, active since 2012, operating in a slightly different realm. What we have been doing is actually trying to improve the situation of natural light within the built environment. Currently commercially active in Israel, and a lot of what we did is thanks to the great support we have received both from the Israeli Innovation System and the EIC. A lot of our R&D was performed with the help of the Horizon grant in 2017. So let's talk a little bit about sunlight. I think we should be all familiar with the concept, but let's dive a little bit about what the sun does. So we know it rises in the morning for most of us, hopefully. And, it rises with a reddish tint, and towards midday, it gets the highest color temperature that's usually coined as a bluish tinge, and then it sets in the evening, becoming reddish again. I'm sorry for stating the obvious, but this is really important because apparently, since humans evolved for millions of years under this natural sunlight, by the way, as most plants and animals also did, we decided this was the method to tell time. So how does our body tell time? Using the color of natural sunlight. This is relatively a recent discovery, so maybe not all of you are aware of it. Look up circadian rhythms and the method in our eyes, which actually measure the bluish component of sunlight. And this is how we know if it's actually morning or evening. So where does it come into play regarding human health and human well-being? This is driving our daily biological clock. So we have an active period. Of course, we are daytime active, most of us. So we are active in the morning. Towards evening, we would tend to become sleepy, tired, go to sleep. And, even without an alarm clock, we would wake up at a certain hour. And this is a critical basic driving method for our bodies. But we couldn't live good enough alone, so we had to disrupt it. How do we disrupt it? Artificial lighting, particularly with a relatively new LED lighting. And this is really breaking down the timing mechanism, which I referred to, and causes a multitude of problems related to our modern way of living inside buildings. How can we solve it? Simple. Just take all of humanity back out into the sunlight, leave the cities, go to the countryside, and everything is going to be solved. But as that is rather non-realistical, we tried to do the opposite and get sunlight to people. So this is actually the main reason for what we are doing at Solight, is really getting sun back to the people. So as you can see, it's difficult to dive in such a short description into all the science, but I'll be happy to share with you, anybody who's interested. There are huge positive influence of sunlight on human health, human well-being, positive attitude specifically for certain communities. And when we go to hospitals, and again, this is just one of many papers written on the subject. By the way, since we mentioned Soroka Hospital, we also participated in the challenge that Yoav mentioned. And when we came to Soroka Hospital with the research, they said, don't show us. We carried out an independent research, and we know this to be very true. So they ran an independent challenge on the positive effects on sunlight, speeding up patient recovery. I know that in the NHS standard of recovery rooms, that is also a factor. And not only the patients, but I think for you, you know that medical staff is always terribly overworked and under constant stress. So there's also huge benefits for the hospital personnel, which is also, I think, a very important consideration to think about. I know that unfortunately you are no longer part of Europe, but I know that in this respect there is a corresponding British standard here. I'm showing this is for the hospital managers now. This is the just the core of the recent European standard on natural light in buildings. This is relevant for any new building, if you were a part of the European Union, any new hospital or hospital wing that you would be considering would have to conform with this standard. Just to give you an idea, we've been around quite for quite a while. I have yet to meet a building which adheres to this standard. As you can see, the minimum allowed levels under the standard is 100 lux. Typically speaking, if you were to go into your building, turn off the artificial lighting, usually you will see that you only get around 30, in some better cases 50 lux. That's usually the level that you will find. So much below standard. And again, this is a conservative standard that was adopted. Actually, some of the experts are claiming that the right levels for people's well-being are actually in the scope of 1000 lux. So this is what we should try to strive for. Solight, we developed a system to help us get the sun back into buildings. We are trying hard to do this in existing buildings, actually in a retrofit scenario. So this is what we have designed our system for. And basically speaking, it's just a large, sophisticated periscope. Here you can see the collecting part, which sits on your roof and channels the sunlight effectively throughout the day. It's a real-time system, so sunlight outside, sunlight inside. Interesting to note that we can control the thermal fraction of the sun's energy. So, for instance, Israel, a very warm country, we tailor our systems to be completely non-heating and help the cooling HVAC system. But as for colder climates such as Britain, we can be solar heating in winter and help you with the space heating, and again, non-heating in summer. So keeping the building cooler in the hot season, that's another advantage we provide. On the inside, we have, very similar to your commercial AC ducts, we have light transporting ducts. Here you can see the system being installed in our first commercial installation in the Israeli desert. So basically, large reflective tubes transporting the light to where it needs to go, and the completed system is completely hidden. These are actually two systems operating in a hotel, and we specifically were requested to create this, of course, much speeded up here, this moving patterns of light. We call it painting with light because this, in our opinion and experts' opinion, is the best way to experience sunlight within buildings. But of course, we can change and modify it according to specific requirements. Why adopt our technology? So basically, the math is very simple. Here I'm showing a comparison of competing technologies, and on the lowest row, I'm showing a standard either human-centric or LED lighting. And again, you can see that due to the fact that our system would provide you with daily light for 20 years without paying a single cent for electricity, this is actually our ace in the hole, and this what makes our system so much effective. So you can see the return on investment is almost 3 times better than competing much lower efficiency systems. Specifically, I think interesting for the UK is that we excel under cloudy condition, which you have a lot of, and it's I think a simple case of moving ahead and getting people the light that they need. Thank you very much.
Ofer, thank you. Yaron, thank you. So just to bring this back to the beginning, what I wanted to present here, along with Yaron and Ofer, is 2 things. A different and unique pathway to assess the various climate challenges within healthcare organizations and healthcare systems, in order to bring out potential technological solutions, aka startups and whatnot, that can actually offer solutions to these challenges. Ofer and Yoav are 2 examples of really innovative approaches to addressing climate challenges. So we have a good 15-20 minutes left, and I want to invite all of you 103 people to ask whatever you want. You can ask Ofer and Yoav about what they're building. You can ask me and Danielle about our process. Our real big goal is to hopefully find a way to bring this process and procedure that we did here in Israel to an organization within the NHS. It's obviously complex to do it, but we are very, very happy and hoping to chat with some of you about how to do it. So Pete, thank you. We're opening this up for Q&A.
You're absolutely welcome. I could see the innovation flooding through those presentations, so thank you for bringing those, Yoav. We have got a question in the chat already from Lisa. Ofer, it's a question for you. Does a building heated by Solight require supplementary additional heating?
Yeah, I've seen the question. Thank you. So I would say that we would be a part of the total heating solution. Again, in very cold climates, I don't think this could be the sole solution, but it is a significant, roughly speaking, it's about 50% of the sun's energy in the range of the infrared, which is what we are talking about in terms of heating. So that could be a very good supplement for your space heating. And specifically, it would depend on the concentration of natural light and heat that we would supply. So I don't think it will completely replace, especially not in very cold days, which you normally tend to have less sunlight. But overall, it could be a very significant addition and reduce your energy consumption on heating as well.
Lovely, thank you for that. There aren't any more kind of questions coming through at the moment in the chat, but please do put your hand up if you want to come in. I know it's sometimes people don't always like to come on camera and ask questions, but I'd love you to do that. I mean, just some reflections for me while people ponder. What I really liked about both innovations, but certainly the last one, is it's almost going back to basics to a certain extent. You kind of looked at the natural sunlight that's good for human health, but added some innovation to allow us to tap into that. And I think there's almost like inspiration in what you do to other types of innovation, what I really like. I think it's that creative thinking that I really enjoyed sort of listening to, you know, in terms of how the product's been developed and why it's been developed. So I really like that. And Yoav, again, just going back to your presentation as well, I really like as well, and I think we need to be honest, that like the funding options. I think what I wanted to do today and in this session is allow people in a really informal way to have these conversations and have these discussions, because I know many people in the NHS and the UK get very nervous about talking to suppliers and innovators because of things like procurement. And I can say that because I used to be a procurement manager. But actually what we're doing today is a very informal discussion, and it's absolutely fine. This market engagement is absolutely you know, essential to any good sort of procurement decision. So going back to what I was trying to say though as well, I think how we go about funding this, I think those four or five bullet points that you put are absolutely essential just to start teasing out a little bit more. I think I can definitely think of a few hospital trusts, and I was on with an integrated care board yesterday actually, that are really receptive to innovation. And I think what we need to do is help them help us with just this design thinking. How could this scheme work? Like you said, there's lots of permutations. So thank you for outlining that, Yoav. Let's go back to the questions then. I was just giving people a bit more time, but Yoav, I don't know, you facilitate your session. I'll let you kind of jump in with the next question, if that's okay.
Yeah. Well, Pete, I do want to point out something that I want to actually respond to what you were mentioning for all of the people, you know, within the NHS who are listening to us. You and I talked about this a lot before, and there's a couple different ways that we look at it when we do these things. The first thing is that obviously there's the risk component. Is this thing going to work out? How much is it going to cost? Do I have to, you know, are there sunk costs, ongoing costs, etc.? That's why we always like to begin with this try before you buy a little bit, right? Which is effectively a pilot or a pre-commercial pilot. There's still cost to that, but there are many ways to create arrangements whereby the healthcare organization and the startup can both benefit from that interaction. And the real key component to that is to properly define what that pilot looks like and the metrics whereby you can trigger a continued conversation and hopeful commercialization. That's the first bit about it. The other thing that I want to mention, and Pete and you and I also spoke about this, is that there's actually something in a weird way easier for dealing with startups like Yaron and Ofer, because, you know, we come from the healthcare world and we're so used to clinical validation, does this touch patients, risk, etc., all this stuff. Startups like Solight, Nostromo do not require that aspect, right? Think about how much effort we put into regarding GDPR and compliance. Here it's different. The KPI can be assessed almost quarterly, which creates an incentive. Okay, there's a very clear climate benefit. There's a very clear financial benefit that can be defined in a fiscal time frame. But yes, you need to accept the fact that someone's going to have to put in this money for the pilot. Now let's figure out where it is. So that being said,
Jesse, maybe it's worth mentioning that now we are putting this is what we just signed, you know, first development agreement with the Kaiser headquarters in Auckland, Bay Area, and we find it a very interesting, you know, attitude. You know, first put it in your headquarters, or choose the building of your what is the weapon of your choice. Put us there, close to you as a management. You can see the data. You can have all the, you know, the data coming. You can validate that, and you can actually make an agreement that is, you know, has triggers of performance. This is very common for companies and technologies at our age. Yeah, we'll be playful. We'll be sport about it. We'll go with you to any validation you would like to go through if it makes sense. And anyhow, the DOE, the Department of Energy, already due diligence our technologies. That's why they're putting $300 million in order that you as a customer will be less worried about the performances, because they are taking, it's a non-recourse. They're taking the whole, you know, risk on themselves, and you as a customer will get a brand new technology with zero risk of the track record and history and performance, because they are taking it on them. So this is a nice, if you're in the States. If you're in Europe, well, we're not there yet, but you can come to the Hilton in Beverly Hills. We'll show you everything.
Sure. Geraldine, I see your question. Can the systems of both Solight and Nostromo be retrofitted into old buildings? The answer I already know is yes. Both Ophel and Yoav do retrofitting and also installation with new ones. So Yoav, Ophel, sorry, I answered that question for you. Pete, I see you raised your hand.
Yeah, thank you. Yaron, really enjoyed your presentation because I've heard about your company through obviously Yoav, and I really saw when I had a look on your website, I really liked the sound of it. It felt really innovative, but it's always nice to be brought to life by the company and the organization behind it. So thank you for doing that. A bit of a question to both of you, please. And I often ask this to innovators, but I try and think about what are the things that people might not like about this innovation. You know, where might the stumbling blocks be, and the barriers? So is there anything technically that people might not, you know, that might struggle with the innovation?
Ofer, would you like me to start? Is it okay?
Yeah, thanks. I'll be brief. For us, I would say that we have found one issue which is quite common in hospitals. Hospitals are intensely dense with multiple systems, and retrofitting in such an environment can be difficult. So, for instance, with several projects that we are working on in Israel, we're looking at new wings. So we found that retrofitting existing buildings is possible, but then there is so much piping and critical systems running both above the ceiling, and it's a nightmare. So this is one hurdle that we have seen, and of course we have to make a certain modification to the building to get our light guide in. So again, I would say that in a hospital environment, the practical way would be to look at a new wing or a serious retrofit of a certain hospital area to consider this project. It's not just a plug and play system that you can easily add. That would be, I think, the major consideration for us.
Thank you. Thank you for your honesty. I'll just say this now quickly. On one of the panels is Jonathan Sylvester, who's leading on the new hospital program in Leeds. Now, again, in terms of the UK, there are a number of new hospitals being built. I think it's good, obviously, to try and influence some of that thinking and that design. Actually, Jonathan, you're on the call. Brilliant. Thank you for popping up. But also the other thing I just wanted to really quickly mention, and maybe a bit of a faux pas, but we called this a green hospital session, but actually I see real merit to community providers, primary care with some of this. You know, they're all in big buildings. So thank you, Ofer, for your answer. I'll let Yaron go, and then I think, Jonathan, you might come in a second.
So generally speaking, we are doing divine interference. No, I'm joking. Just interference with the pipes and the critical mission critical systems of the hospital or the hotel or whatever. So there is a sensitivity to give us the penetrate the pipes at first to start with. So we need to be very, in a point of maturity, reliability, supporting, being supported by the best service providers and so forth, in order to lower the risk. And as you know, the maintenance engineers, they don't want to have any risk with anything. They are not on the innovation side. They are on the maintenance, ongoing, stable operation. They are not into expertise, into doing experts. So it's always about getting the attention of two different levels of the organization. The first one is to bring on the engineers, the chief engineer and the maintenance the team, to see the technology with their own eyes, to meet the people, to understand how solid it is, and that make them feel very comfortable that we're bringing zero risk to their normal operation. This is very important. Next thing will be to bring the ownership, management, top management. And when the top management will say, hey, it's an amazing idea, or it might work, maybe we'll find place for it. But what does our chief engineer think about it? So we say, hey, you know what? You always been to our facility there, and ask him and see what he thinks. This is the only way we can make a sale goes. In United States, there is another word called hashpad. HASPA, which is, I'm not sure I'm even pronouncing it. It's like the organization of seismic, for everything goes into hospitals, goes through the HASPA, whatever. So we need to put now like a good $100,000 in order to just pass their seismic approval. If you don't go through that, you don't go into any hospital in the United States, especially not in California. So HOSPED, it's called something like HOSPED. So yeah, so there are other like regulatory, for equipment providers to hospitals in the United States. There are some regulatory, gateways. Other than that, yeah, it's hard to be first. It's hard to be innovative. It's hard to be, and hospitals are more into, let's see how it works different, and when we'll join for good reasons. But we believe that we'll be able to bring some hospitals to be first in the world. We did it in Israel, so Soroka is already installing it, and after it will be installing Soroka, I'm sure that other hospitals will feel more comfortable to go and do that afterwards.
Lovely. There is another kind of question around procurement, but we'll take that in a second, Yoav, if that's all right. I don't know, Jonathan, did you want to come in and just introduce yourself and just a little bit about your honor? You're going to be part of the panel at 12 o'clock, but
yeah. Cheers, Pete. Thanks for bringing us in. I'm Johnny Sylvester. I'm a senior project manager here in Leeds, and we're part of one of 40 hospitals of the new hospital programme in England. So obviously, everything that's been mentioned this morning is fantastic. We're aligned on our thoughts around how do we bring in things like natural daylight throughout buildings and look at how we provide energy, heating and cooling to buildings in a sustainable way. I guess I've got a bit of a question around how have you factored in for kind of resilience in the future? So, with extreme weather conditions, appreciating you're doing a lot of work in greater climates than we have here in the UK at the moment. Have you considered, kind of weather factors in the next kind of 20, 30 years and what impact that may have on some of the innovations that you're looking at?
So if I may start, we bring a huge amount of resilience and redundancy to the building that we're retrofitting, because almost every building that we have was built with an over-designed cooling systems, and now they're struggling to cool at heat waves in Los Angeles. They're struggling to bring this cold energy, and in hospitals it is the redundant part or the over-design is much bigger than office buildings. So every system is like over designed, and still the systems are struggling. If one chiller has problems through a heat wave, the hospital might be in an uncomfortable situation, or bringing chillers, rental chillers to support this event. We are building a whole system which is redundant to the existing system, so we are actually pushing away over designing the already over designed system, because we are an ice storage, usually with a special pony chiller that charges the system, make the ice. So everybody enjoys that to start with. So in hospitals, the mechanical team, they're embracing us for this reason, because this is on their chest, the thought that there will be a heat wave and they have a problem with chiller, and what will happen if the heat wave won't go away after 2 days or 3 days, and they know that they will be on the line. And so they are very, very enthusiastic to hear what we have to say, even if they less care about the green and the clean and the and the decarbonization. They are very happy to get more equipment that will help them with the high seasons or whatever you call it.
Can I just have a follow-on question from that? I'm sorry if I missed this because I was just looking at the chat briefly, but is the system sort of contained in a way that, like, say, for example, flooding or any kind of issue that might happen on a hospital site or any other kind of, how well contained is the system, or where location, what does it do in terms of that climate adaptation to prevent us from those adverse?
The system is totally disconnected from the general system. It is a glycol-fed system, meaning it's an antifreeze that's running between the charging chiller and the bricks. And the only communication, it's like a couple, a very safe couple on a date. So they don't exchange fluids, if you might say. No, I'm joking. So we don't exchange fluids. We don't exchange fluids with the hospital. We just exchange thermal energy. So we are communicating with the hospital through a heat exchanger, meaning everything that stays in our room, does not get to the hospital and the other way around. So we are very safe on that side.
Lovely.
I mean, if we have a
Lovely.
leakage, the hospital doesn't know about it.
Lovely. Good. Excellent. We'll hand over to Arthur then.
I would also like to add that we also introduce a very nice element of resilience into the building, because of course our system is totally passive, so off-grid, and would continue to provide daylight where installed in case of a disaster scenario. Now, what would happen is that in daytime you wouldn't be using your emergency lighting, so you would probably double its capacity. We always introduce an automatic control system, so your batteries would only be depleted at nighttime and your system would probably last longer. So if you're looking for an extended event of several days, your emergency lighting would only work at night and provide you with double the capacity over the original design. So that's also a nice boost.
Lovely, thank you. Yoav, I know we're coming to the end of the session. Just to take one more quick question or comment in the chat around procurement, about how do you make these changes happen in the NHS? Do you wait for procurement to reach out, or do companies reach out to procurement? I think that's not an easy question to answer, but what I would say is it's like these discussions we're having today. Let's have the market engagement. Let's get the cogs ticking about what could happen before we even think about the procurement side of things. And as I think it was Yaron that you explained, sometimes these conversations need to happen behind the scenes with the chief engineers, with the board, you know, so that before we even start writing specifications and going out to tender, we understand, as I say, what it is that we think might add value. And the only way that you can do that is to hopefully be exposed to this great innovation. So there were just sort of my final thoughts on that particular question, Yoav. I don't know if you wanted to wrap up with anything.
Look, I mean, we talked about it briefly. There's actually a benefit to dealing with startups like this as opposed to startups that are doing like long-term oncology, whatever, because these are quantifiable, right? It's very hard to quantify certain aspects of long-term actual medicine, whereas startups in the climate space were advanced enough where we all know what a metric of success looks like, more or less, and we can only quantify it in a time period that makes sense, right? So it's basically just kind of picking up and saying, okay, you know, we'd be happy to work with any organization in the UK as part of the NHS, saying, okay, let's start dissecting this. Let's figure out something that's strategically relevant and just go, right? Someone has to take the initiative. Healthcare organizations move slow. Healthcare systems, also in Israel, also in the NHS, move slow, but there needs to be someone who picks up the ball. You know, so from that perspective, Pete, this was fantastic. Thank you for inviting us. Thank you for joining us as well.
You're very welcome. Great. Thank you for the comment, Geraldine. Yeah, I found it really interesting as well. Yoav, I'm sure will put his details in the chat. I'm sure Yaron will do the same. Reach out to me if you want to discuss this as well. The cogs are definitely ticking with me and Yoav as well. So let's keep the momentum up on this brilliant topic. Thank you for your presentation. If you want to go and join some of the other sessions, they'll be running for about another half an hour. I think we've got some innovators. You're more than welcome. If you need to go and get a break, a comfort break, feel free to. As I said, please join the roundtable at 12 if you can. There's 2 going to be taking place, and you'll get to hear from some people working with the NHS in sustainability and actually some industry. So thank you again for your session, and yeah, look forward to speaking soon.
Thank you. Thank you so much.